want to share this article I came across. It's a sad example and a cautionary tale of what many people throughout this country are now finding out the hard way, and that is how irrational decisions that feel good in the moment can come back to hurt you later. Now, here's the article, and it is from KFF on Apple News. In Sugar Grove, North Carolina, there's this couple by the name of Ross and Rebecca Tobias who saw their health costs rise recently, having relied on the Affordable Care Act for federally subsidized health insurance since its start in 2014, in which it was originally under the name ObamaCare. Year after year, this couple in Western North Carolina kept their coverage because they believed that the peace of mind that they got from having it was worth the cost, and it was. But in December of 2025, all that changed. The Tobiasons had to cancel their health insurance when they found out that their monthly premiums would jump from $130 to $550 a month, more than $550 a month. Now, this couple owned a small automobile repair shop just west of Appalachian State University in the North Carolina mountains. Rebecca worries about her husband. He's the mechanic, and it's a dangerous job, okay? So dangerous that a spring once shot a metal ball joint into their garage wall. And another time, a heavy object crushed his thumb. But it got even worse in 2020 when her husband became mostly blind in one eye after repeatedly getting metal shards in it and developing an infection in his cornea. Now, this sounds bad, I know. This sounds real bad. But let's dig deeper. Let's dig a little bit deeper so that we can get some context. And then you'll realize that what is happening is, in a lot of ways, self-inflicted. The article continues, pointing out that people who get health coverage through the ACA marketplace get a premium tax credit, which lowers their premium. Congress increased the premium tax credit in 2021, which lowered the cost even more under then President Joe Biden's American Rescue Plan Act during the COVID pandemic. Now, the expanded subsidies from this American Rescue Plan doubled ACA enrollment to 24 million. Doubled it. Now, when the Republican-controlled House allowed those tax credits to expire at the end of 2025, healthcare premiums went through the roof. Medical students now have fewer options to pay off their student loans under the big, beautiful bill that President Donald Trump signed into law to reduce funding for federal health programs and to restrict access to health coverage. Now, the Republican senators, rejected a Democratic bill to extend the subsidies for 3 years. Let's look at the data to see who benefits from ACA the most. Now, 23,130,860 Americans receive federal insurance subsidies through the ACA. Whites receive 45.8% of ACA benefits. Next, we have Latinos at 29.4%, followed by blacks at 16.3%. Then we have multiracial and others, 1.7%, and lastly, others, just plain others at 0.7%. Now let's see how North Carolina voted in 2024. Donald Trump got 50.9% of the state, or 2,898,423 votes, while Kamala Harris, she got 47.6% of the state, or 2,715,375 votes. Now, there are 100 counties in North Carolina, and of those, Donald Trump won 78. So he won by 3.3 percentage points over Kamala Harris, and yet he won more than 3/4 of the counties in North Carolina. So something is missing. Let's just look at the 5 poorest counties, which are Robeson County, Washington County, Halifax County, Bertie County, and Scotland counties. 3 out of the 5 poorest counties in North Carolina, Washington, Halifax, and Bertie County, voted Democrat. Those 3 counties that voted Democrat also had blacks in the majority. So you know what that means, don't you? The 2 that had whites in the majority, Robeson and Scotland counties, voted Republican. They voted for Trump. No class solidarity after all, even though they are poor. And you know why? It's because of race. Yes, race. That's the